Welcome to Fuzzybutts and Friends. Your big dog here, along with my co-host and occasional kicker, Ginger Morgan, the executive director of Puppy Up Foundation. Ginger, how are you today?
I'm doing well. It's been a busy morning.
It has. It always is here at the Morgan Manor and the Fuzzybutt Studios. Today, we're really excited to have with us somebody that's really such an important part of my own personal story, the Fuzzybutt story. We'll get to that in a moment, but it's Dr. Rachel Venable. She formerly was with Colorado State University, and she now has her own consulting practice, something I'm really excited to talk about. Welcome to Fuzzybutts and Friends, Dr. Venable. How are you?
I'm great. I'm so glad to be here. Thank you very, very much.
Good to have you. Well, let's just start it with how how our paths intersected. We connected when I brought Murphy out to Colorado State University. Where were you at? Were you a resident then?
Yes, I was a resident.
And that was back in 2010, and I brought Murphy out there, and he had some nasal bleeding and some other problems, and then we got the diagnosis of nasal adenocarcinoma, and we went through the IMRT along with, what was the radiologist's name? I'm horrible with names. Is that Susan?
LaRue.
LaRue, that's right. Yes. And then we had Dr. Withrow. Dr. Steve Withrow, fortunately, was kind of like overseeing the whole treatment plan, everything. And we just received such phenomenal care at Colorado State University. So I wanted to begin to thank you for the wonderful care that you took of Murphy. You were great as a resident. Your bedside manner was very professional. You were precise. You made an impact on me. So when Ginger informed me that you had this new consulting practice, I was excited to talk to you. Unfortunately, with Murphy, we didn't get the outcome that we wanted. But my journey since our paths connected has continued with Puppy Up and now with Fuzzybutts Studios. And my main mission here is to try to figure out what really are the biggest problems about getting the best quality care to our companion animals and their pet parents. So let's start off with what is your own personal journey in veterinary medicine, Ben, and what's your passion?
Well, I would say my journey started, I grew up on a farm in the Midwest, so I've always been around lots of animals, and just actually originally wanted to do zoo animals. So I actually did some job shadowing in high school at a zoo, and from there realized that I was going to need some more education and started thinking about being a vet. And then I started hanging out with vets and just fell in love with it. So really enjoyed it. So that's kind of where I started. And then my journey. So I went to vet school at the University of Missouri, because that's where I'm from. And then I did my internship at the University of Georgia, and then my oncology residency at Colorado State. So that's where we met. And I was actually fairly early in. I think I was in my first year when we met with Murphy. And yeah, it was great talking with you guys and getting to know you and Murphy. He was such a sweet dog, such a big fluff ball, like that breed. They're just so sweet.
Yeah, it was a tough time for me. Sorry, go ahead.
I want to thank you for being so patient and explaining everything so that I could understand it. Luke has a little bit of a medical background. I didn't, and I don't. So I do want to thank you for doing that.
Oh, certainly.
Yeah. So, wow. So you're only your first year of residency at CSU. So where did you go? How long were you there for? Is the residency like medicine is a 2-year program?
It's actually 3. So it's a little bit different in vet med than with people. So your internship and residency in vet med are very separate. And my understanding in people, more often it's a combined thing. And so, yeah, it was a 1-year internship and then 3-year residency. And then I went to private practice. So I worked with a Blue Pearl back in Missouri for about 2 years. And then I came out to Arizona. So I worked at a private practice in Arizona. I did that for 6 years. And then just recently this fall, I started a teleconsulting oncology company.
Well, what did you learn from private practice that led you to go out on your own? Because that's not very common, right?
The teleconsulting?
Or just going out on your own, I guess, so early in your career?
Yeah, right. Yeah, so neither of them are common. You're right.
Right.
So yeah, it's
well. Tell us about the vision for your. Let me get it's the Pet Cancer Care Consulting, correct? That's the name of your business, and it's based in Arizona.
Yes, so that's where I'm based. But honestly, because it's teleconsulting, I really can talk to people anywhere, and so that's what's so nice about it. And I think what got me here is, in private practice, I would see a lot of people, and especially with the pandemic, things, just our schedule got even busier, which was, it was a little strange. Because, you hear about like people adopting puppies and things. I don't ever see puppies, right? I mean, it's more the older dogs. But I think what was kind of happening is people were now at home with their pets. So they were seeing what they were doing, versus before when they were at work, they didn't necessarily notice everything. So I think maybe that was one reason we were busier. But definitely with COVID, I got introduced to Zoom, and all these different video platforms that I don't think I was really aware of particularly before or never really thought about. And one of the things in private practice that just I found frustrating was that there were so many people that I knew were just falling through the cracks. They couldn't get into me. The wait time was pretty long, and it's one of those, and that always really frustrated me. But sometimes as one person, there's only so much you can do. And we just need more oncologists is the biggest issue. But so there was that wait time. And then also there was travel. You have people that just can't travel. Mostly your oncologists are kind of focused in one area. So if you don't live there, even in the state, they could have quite a ways or sometimes health issues or whatever, and they couldn't make it. And so that was something I just became more and more aware of. And with COVID and the video platform, that's where I really got the idea of, maybe there's a way that I could actually reach more people by doing this platform. And I think now people are more comfortable with it. They're more accepting of talking to someone over a computer versus, a couple of years ago, I don't think they would have. I think people wouldn't have been as comfortable or as accepting of that.
Well, that's exactly right. That's kind of the nut of where I was driving was this born out of the pandemic? Because I know Ginger can speak to this on her own, but for me, I don't know how many vet visits I've had during the pandemic, but it's been many, including the end of Ginger. What did I take? Hudson? Was that Mississippi? That was Jackson.
It was Mississippi State.
Mississippi State. Anyway, Hudson, he crashed during chemo and he passed within a week. It was happening very fast. But that whole process to deal with the pandemic and stuff, it's been a nightmare. It's so hard. For me, it was so hard as a pet parent, being in a crisis situation. The emotions are high. You don't know what's going on. You're scared, and then you have that degree of separation. You not only can't be there with your loved one, you can't have eyes on them as well. And that's what I love what you're doing is at least you offer those additional set of eyes that if you can't have a consult within your own community, at least you can actually see and have that interaction. Ginger, I know you've had a lot of frustrations during the pandemic as well. And so telemedicine is a great idea.
Yeah, I think you are spot on, Dr. Venable, on doing this. I think we're going to give you a lot of business.
Well, that's awesome. I'm certainly happy with that. And I'm so sorry of everything you had to go through with Hudson. I mean, that's terrible. And I'm sorry,
Well,
just
I'm
the illness.
just one of millions and millions of pet parents out there. As you know the numbers. I was listening to one of your podcasts that Ginger sent me, and I think they use the number 6 million new cases of cancer in dogs every year. And I think that's a pretty conservative. So I'm just one of many, but I just happen to be very, very pissed off and I don't think we're achieving the level of excellence and across the board. And everyone, and pet parents, we're not doing our best on our end. We're not educating puppy up. I'm personally not doing my job. I've got to get out there and do more. So this Fuzzybutts and Friends is really this platform. And like you said, I love how you said it perfectly, is that what the pandemic did is the pandemic enabled us to accelerate the tools, to make the tools using Zoom and the wonderful 4K video cameras that we have in the audio, and have the platforms that we now can have this patient to professional provider interaction. So how old is your practice, Dr. Venable? How new are you? How long have you been in business?
Yeah, so I actually just started doing the teleconsulting this past September. So pretty new. So
Okay.
yeah, I've been in oncology for quite a while, but the teleconsulting just kind of started that. So I've mostly been seeing cases in Arizona, but I'm trying to branch out to some other areas. You know, there's several states, like one of them that I just recently started reaching out to is Nebraska. You know, that you've got Omaha, Lincoln, and they don't have an oncologist in that entire state. So people have to drive quite a ways, you know, 2-3 hours or more to get to an oncologist. They have to either go to Kansas or Iowa. Certainly if you're in West Nebraska, you know, you have a really long, I mean, they may even go to Colorado, I'm not sure. So there's several states, or like Alaska only has one, Kentucky doesn't have any, Hawaii doesn't have any. So there's a lot of states where there's just no access.
Yeah, I want to get into that a little bit later about that. We had a puppy up walk in Nebraska as well. And that was we didn't have an anchor oncologist there, just right next door to Memphis, Arkansas, no board certified oncologist. And so I kind of wanted to get in that in terms of Hudson, but I want to stick with your consulting practice because I know the pain. Ginger knows the pain, and we know the service, the need for the service that you're providing. So there's the pain and the service that you're providing, and it's great. So we're going to do our best to help make sure that pet parents can at least have someone that they consult with face to face, because it is a terrifying, absolutely terrifying experience, especially pet parents who have been through it, who are going through it for their first time. I'm 100%. I've lost 3 dogs, all 3 to cancer. Ginger, how many kids have you lost to cancer now? I'm not including mine that you consider that you co-opted as my kids, but
it is, I think, 8. I've lost to cancer. Now, I will say this, Dr. Venable, they're all well, except for 2 of them, they were all well over 10 years old. One died, she was 16. So,
wow.
And Luke, I hope I'm not jumping ahead, but at some point in this, if Dr. Venable, if you could let us know how the pet parent gets in touch with you or lets their veterinarian get in touch with you.
Go ahead and get that information right now. We'll do it several times, but I believe in repetition and rote memory. Go ahead.
Yeah. Well, so pet parents, they can get in touch with me really from my website. So my website, it's pretty simple. It's petcancercareconsulting.com. So it's kind of a mouthful, but I feel like from that mouthful, you know what it is, right? There's no guessing.
You know, we go to we've been to many years the Veterinary Oncology Society meetings, and when you go to the exhibitor area, it's just alphabet soup. There are so many acronyms out there, and you you guys have so many. The Companion Cancer Alliance. It's just so many acronyms, and I'm dyslexic amongst many other pathologies I have, so it's confusing to me. But we'll make sure we get that link and that information out to our audience as best we can. So walk me. So you've only been in teleconsulting since September. So walk us through the process. Once patients do contact you, because is it the same way with non-telemedicine? What's the opposite called? I'd say real medicine, because you're offering real medicine. Non-telemedicine, I just don't know. In-person medicine, there you go. Yeah. So the process in in-person medicine, obviously, is you have your dog becomes symptomatic, you suspect something's wrong, then you contact your GP, your general practitioner, your vet, family vet, and then they make the referral to a board certified oncologist, of which you are. So I imagine the same how does it work in teleconsulting? Walk us through that.
Yeah, so with teleconsulting, it's kind of similar. Basically, how I work is what you said. So you know, the pet owner, you recognize there's something going on with your pet. You go to your family vet, they diagnose them with cancer. And then really from there, you can go straight to me. I mean, I basically partnering with the family vet is really how I'm working. So I work with the vet and the pet parent. And I think it's important to have that three-way conversation versus, there's not many states, but there's a couple where you can just go straight from the pet owner. You could talk to someone online. Most states don't allow that. But I do think it's important to keep your family vet in the loop so they know what's going on. Also, sometimes there's things in records that don't come across. I actually did a consult the other day, and in the records I got, there was some notes about the chest x-rays, and they basically made them sound like they were fine. And which is common as a specialist, we don't always get the images, or, not every vet has a radiologist review their images. So that happens quite a bit. But then because the consult I was doing, the vet was in the room while I was going over the history. So the pet owner, basically how the consults work is the vet clinic makes the schedule, like they schedule with me, they have the account. So then the pet owner comes back as a recheck. So they're at their GP's clinic with their dog. And so the vet, the pet owner, and me are all talking. So I talk to him over the computer or a tablet. I've even been on somebody's phone before. It's whatever you got. I try to keep it simple. But in this situation, what was interesting is I was reviewing the history with them, and the vet actually said that, they had the x-rays reviewed, and the radiologist actually saw some other things, like they saw some big lymph nodes and some fluid. So that really changes that conversation versus the notes I had. The x-rays were like, they, look like more old dog changes. And that was it. I didn't have any notes about sending it to a radiologist. And like I said, that could happen even in an in-person visit where, those are the records I would get. And like I said, commonly we don't get the x-rays because they're not always as easy to transfer. And so I would have been missing a huge piece versus because the vet was there, they were able to pipe in, and that really changed things. So I think the continuity of care with this model is pretty important. And I think it makes people feel comfortable, right? Like most pets, you like your family vet, you feel comfortable at that clinic. And so I think they feel nice, because sometimes going to the specialist, it can be a little intimidating, it's a new place. And so I think having us all together, I find a lot of pet owners just seem more comfortable, and so, yeah, with mine, I will review the records, and then I touch base with everybody. We have that conversation. I also like to have the vet do an exam on the pet. So to make sure like the tumor is not coming back or the lymph nodes aren't getting big, things that I don't always expect a pet owner to know. And then I talk pretty long detail about the cancer, testing, treatment, prognosis, all those things. And then I type everything up. So I give it to that portal account that the vet clinic has. So I put everything in there, and then I email the pet owners directly.
Wow. So you have really an interesting value proposition, a bit better than when I originally thought. And I like that. I really like having this conversation with you, because you not only compress the time from the moment at which you suspect the dog is symptomatic, or the companion animal is symptomatic of cancer. So you compress that time to the initial, hopefully, consultation. But you also, I love the fact that you prefer to have to do the consult there with the GP. That way, the GP is your diagnostic tool, or an extension of your diagnostic capabilities. So it really enhances that initial. It really makes the initial consultation, the initial vet visit, almost like the consultation with a board certified GP. I'm sorry, board certified oncologist. So that's a heck of a value proposition for me. I would do that hands down any day, because to me, I'm so excited about that. Just thinking it through, because I would always choose that, right? Unless it's my GP, my vet, and it's like with Hudson, and it's a lump, and I suspect it's mast cell, and it's just go there and aspirate, right? There's no real reason to probably bring a medical oncologist into that scenario, but certainly if it's something unusual first time, I would say any other occasion, I would just think, if at all possible, if I'm going to set up an appointment with my GP, say, hey, I am palpating a mass right here in their side, and I suspect maybe potentially a soft tissue sarcoma or something like that. I set up the initial appointment with my GP here, Dr. Covington, and so I could have you there, I guess, connect there and be a part of that consultation, right? But I'm just going to do that going forward. I mean, because you're able to better help that even though I actually with Dr. Covington, it's important for me because I've only seen, we lost here in Memphis, we lost our great diagnostician, Dr. Blackburn. He retired and now he's lost somewhere in the mountains in the Appalachians. But he was a phenomenal diagnostic. Yeah, Ginger can tell you some great stories about him. But we lost him, and so I really haven't had a vet here. And I like this new Dr. Covington. She seems capable. She's like you. She's very. She speaks to me on a level of which I can understand, and she's very thorough in her assessment. But I'm very new to her, so for me, just having you as a part of any addition, any meeting I have or any appointment I have with her going forward, having you a part of that when I suspect it's cancer with Indiana. Heck, sign me up. So consider me a client going forward. I'm excited about what you're doing. Usually I don't talk this much, Ginger, I think, when I'm doing podcasts, but I'm excited. Count me as a customer.
And I have a question to ask. So Luke, okay, let's just say I find a lump on my dog. Should I have my veterinarian do like a needle aspirate of it, get those results back, and then we would consult with you?
Yes, we'd want to know for sure it's cancer, and if we can, what type, just because that will really guide the conversation,
Okay.
you have with me. So I feel like you will get more kind of bang for your buck, right? So I'll be able to talk with you more specifically about things.
Mhm.
And as far as getting that diagnosis, if you have something like the needle aspirate, and it says cancer, then we could go from there. We could do a consult at that point. If you have x-rays that really look like cancer, so like a bone lesion or maybe something in the lungs, we could talk at that point. So I think sometimes people worry like, oh, the tumor has to be removed and we have to have a biopsy, but not always. I mean, if you have something else, either on imaging or cytology that's cancer, I mean, we could start the conversation then, especially if, either as a pet owner or maybe even your vet isn't quite sure what to do for treatment. I think that's when it would be appropriate to do that consult.
Okay.
So let me just clarify, make sure I'm correct. But there are some cases that the pet parent can, and I'm not saying do this at all. I believe in the Western medicine model to a certain extent, and it exists for a reason. That the general practitioner has, like you said, the history, and the history is so important, especially when there's the specter of cancer is there. So I believe that, but there are some cases, if I'm understanding your model correctly, where the pet parent can sometimes deal directly with you without a referral. Is that correct?
Not really in the model that I'm doing. So
so the referral is required.
Well, basically the vet clinic is the one that has the account that can schedule everything because it's still technically consulting. And that's also somewhat the legal aspect, and the telemedicine laws are kind of tricky. And so that's one reason. So yes, a pet owner could reach me. They can contact me from the website and tell me, what's going on. And then basically I reach out to them and we try to set up an appointment with their vet is how that would work. So I wouldn't be able to give them details about their pet's cancer. One, I haven't seen the records anyway, so I would hate to misspeak, sometimes what an owner's perception or what they're thinking. And then when I look through the records, it's actually different, than how I would interpret it. So I actually go through. So the vet clinic makes the account and they're the ones that schedule with me.
That makes sense. I guess there are state licensure issues that you would have to have the consulting. That's why you have the consulting model and you go through the vet clinic. Makes total sense to me. Well, I love it. And by all means, I love my general practitioner, Dr. Blackburn, and I've got two new ones, Dr. Covington and Dr. Heather for Grayson, who I'm liking as well. So it's a great model. It's exciting what you're doing. And I think you have tremendous value to add. And again, how I'm serious in that Ginger can help sign me up as a client, because I at least want to get that. I want to get that relationship established. Hopefully, knock on wood, I won't have to consult you for many years in the future, but I would like to have that option already in place. And it seems to me it would probably make sense for pet parents to go ahead and I guess maybe follow you, or do they sign up and at least establish a relationship with you for maybe when that moment, or how do they get your information to their GP or their pet clinic, their vet clinic?
Yeah, that's a great question. So, they could definitely sign up like for my newsletter. I don't really have a way for pet owners to sign up to like have an account just the way my website and kind of portal works. It's really more through the vet. So the biggest thing would be to let your vet know, and the vet clinic could form an account at any point. There's no fee or anything like that for having an account with me. And as far as letting their vet know, I think they could send them my info for the website. That probably would tell them the most. We're on Facebook and Instagram too. And even, I would be happy to talk to them. I've been talking to a lot of vets on the phone or email if that's better for them, so that would be the other way too. If it's something where your pet doesn't have cancer, but you want to kind of already have things sort of lined up for, when that moment, hopefully it doesn't happen, but a lot of pets, we know it does. So yeah, I think just having your vet know about it and having an account.
Well, that's the right limiting step to your model right there, is that the vet clinics then that you partner with are doing your marketing and advertising to pet parents. And as you and I know, veterinarians are horrible at marketing and a lot of business as well. So that's why you need well, you don't need, but partnering with organizations like Puppy Up that are 100% pet parents, and that we also work with researchers and funding research. And we're going to be working with pet parents in a whole new way very, very soon. So it's, again, great we're having this conversation, because you do need to get your word out to pet parents that you're a resource, a very, very important resource that's available to them. Because if they don't know, then they're reliant on their GP to know about you, and that's, boy. So we certainly have to do our. Go ahead, Ginger. You want to say something, please?
So yeah, I always want to say something.
She always does.
Are you doing telemedicine in all states, or do you have to be licensed in each individual state?
So because I'm doing consulting, because basically I'm consulting with the vet and the pet owner is there, so it's kind of a twist on the traditional consult. Okay. I'm able to do it in most states. It is something though that I do kind of have to double check. So looking through different state laws. So if I get a request from a different state that I haven't gone to yet, kind of looking through the laws, I also have a lawyer, I've had a lawyer review everything, because some of it can be a little bit tricky as far as trying to navigate. For the most part, I don't have to have separate licenses in each state. Some states, they do want you to have that. So it's just kind of navigating it all. And some of it, a lot of states, it's sort of a gray zone. They don't really have, they're still sort of figuring out and building out the telemedicine laws. So I think that's the other thing too, is, I think we need to advocate for, we need to have common sense, right? I think what some people are worried about is some huge company, is going to come in and like wipe out all the veterinary business. But I don't think that's going to happen. There's been surveys that have actually found that people who seek like teleconsult, like online care, basically more often those people go back to their vet for those additional tests. So if it's something where it's like they can't get into their vet, or maybe it's after hours or something, and they're Googling, looking online, and if they talk to a vet, they have actually found that most of those people then end up following up with their in-person vet. So I think that's something we have to watch for too, because there's been a few states that have made pretty strict telemedicine laws, which I think are a bit unfortunate because they're just blocking progress, right? I mean, I think we're always a little nervous about change, and we're all kind of creatures of habit. And I think vets can really fall in that category, and, but I think change and progression, it's going to happen whether you want to go with it or not. I think the consumer will demand it. So I think that's the other thing, as far as advocating, is I think we don't want to get too narrow-minded or too against, telemedicine. We do need some rules, and we don't want to just, make it the Wild West. But at the same time, I don't think we want to get so against it that we, put all these laws in place where it's not even possible.
You just said the key word, the key phrase there, which really is for me a passion phrase. And I think really is my big driver going forward. And I think big driver of Puppy Up is consumer driven, pet parent driven. My chief and categorical complaint of the veterinary oncology community is that it's science and clinician driven, not pet parent driven. And I get it, and I understand that's the way human medicine was the same way. And when you think about the dynamics of that relationship model, it's really staggering. You have a community that was 450 board certified oncologists a year or two ago. I don't know where it's at now, but it's extremely small. And then you have tens of millions of pet parents with actual cases, with actual cancer cases. And so the power dynamics, I don't like using that word, but the structural dynamics of that is significant in that there's that veterinary oncology is an institution, and you have traditions and ways of doing things that are very important and critical, but sometimes they're antithetical, I guess, to the urgent needs of the actual patients themselves. And so it's this dynamic that really fascinates me, and that's why I want to work with veterinary oncologists, and certainly I work with people like Phil Bergman and Craig Clifford, and been working with them and talking to them for years on how we can do a better job of getting not only improving communications, but also doing a better job of partnering with pet parents. And that's sort of really one of the fundamental principles of our mission at Puppy Up, at the Puppy Up Foundation. And I want to speak to that as it pertains to Hudson. And I think this will underscore, perhaps to a degree, the importance of what you're doing, teleconsultation to pet parents. And that's with Hudson. We don't have a board certified veterinary oncologist here in Memphis. And so I've used someone I've used before, and that she certainly has done a lot with oncology. And it's he's had, I think we determined that Hudson is a 10-year survivor of mast cell cancer. Is that right? About 10 years. So long chronic history, about 10 years, I think. So he's been having mast cell tumors, and we all know, or I knew where that ultimately goes. You're going to get one or two that goes really, really crazy, and you're going to have a problem. And he was 15. So I don't really want to paint this scenario incorrectly, other than he had terminal metastatic mast cell cancer. That was where it was going. There was no other end. There was no way to stop that from going any other direction. However, we had, I believe that one of the mitigating factors was a bad reaction to the treatment plan, or that it wasn't. So at least in my mind, one of the great things that perhaps your service can avoid is having that additional knowledge base and additional experience base. Like you said, you've only been doing telemedicine, teleconsulting since September, but you've been a board certified oncologist for many, many years. So you've seen a lot of patients. And so I believe what your service can offer is, in that framework, you can provide a much better, hey, look, yeah, this may be your treatment plan, but this problem might happen, or that problem may happen down here within the next couple of days, and we need to have an emergency response plan A, B, and C if such things happen. So look, I should have prefaced this by saying I understand where we're at. I know we have a limited amount of board certified veterinary oncologists for a reason, and a very, very good reason. That pool should be expanded, and that's something we want to and we will talk about. Phil and I talked about it on podcast number 3. But the good thing about having GPs, general practitioners, that are able to provide some cancer care support is that pet parents can get some support while they're waiting maybe 5 weeks or 6 weeks to get that initial consultation, which Ginger and I know drives pet parents absolutely ballistic.
I would go insane. If I had to wait 6 weeks, I would totally go insane.
Ginger and I've been here at Ginger's house and seeing her the nights of stress that she's had to stay up when you know it's cancer, you know something's wrong, and you're just waiting for the initial consultation. So I don't really know where I was going other than trying to paint a picture. Did you use Hudson? And I've used all of Hudson, Murphy, and then Malcolm, the first dog who lost to cancer, as sort of an example for pet parents to learn from. And so for Hudson, the missteps or mistakes, however you want to characterize them, that were made, I feel like could have potentially been gamed out better, and there could have been potentially a crisis response plan if we had that initial consultation, because we don't have a board certified oncologist, medical oncologist, or surgical or radiologist here in Memphis. So what can we do with Puppy Up? What literature do you have? How can we help you get that message and Hudson's story out to pet parents?
Oh yeah. And again, I'm so sorry you went through all that. And one thing, to kind of talk with that, some of your points of, yes, there's not enough oncologists. And so that's why I think it's so important to partner with general vets, right? With family vets, because they're really the front lines. And I think that's how we're going to increase access to oncology, because yes, there's waits. When I was in private practice, my wait got up to 6 to 8 weeks. And, personally, I didn't feel like that was acceptable. But at the same time, I didn't know what to do, but then like we talked about other areas where they just don't have oncologists. So yeah, I do. One thing also with my teleconsulting is you can actually, if the pet owner and the vet, if they would like to purchase a protocol. So I have really detailed roadmaps essentially for chemo and some of the oral pills like Palladia, some of those things that aren't technically chemo. And they're really roadmap, like you were saying, if this happens, do this. And so I have that, those are part of those plans. So it has, when to come back, what dosage to use of the drugs, what tests to run. But then it also, I have at the bottom kind of, if this happens, do this. If this happens, do this, so it just kind of helps to guide them. And of course they could always, the vets can always reach out to me too. But not every vet is comfortable doing like IV chemo because you need more of the special equipment and safety handling and things. So actually I have an oncologist here in Arizona, Dr. Hershey, who partners with me in the sense that if I do a big consult, go over everything with clients and they want to do IV chemo, they can actually get in sooner with her as a drop off because she doesn't have an opening to do that, that real piece of time of talking with them. So that's something too. I'm kind of hoping maybe that's another way I could sort of expand this for some people too, is it's like, look, I know you can't get in with the oncologist right now. They just don't have that chunk of time in their schedule. But, if you've already gone through the consult, then maybe as a drop off, you could start to get those treatments, if your vet's not comfortable doing the IVs. So that's something I'm hoping, to expand to some other areas too, just again, to increase that access. And pills, they're more, the vet clinic doesn't have to worry as much on safety. It's more the pet owner. So talking a lot to them as far as, handling and making sure that they're, being safe with the medication. So I think from that part of the story, how can I help with, just if there's not an oncologist, what can we do? So that would be another option. And as far as sharing the story I think just as far as Hudson, maybe there's some more we can do with Puppy Up or even my website or social media, getting more of that stuff out there. And that's something too, like you were asking me at the very beginning, like not a lot of people go out and do this. And it's true because as vets, we have no business training, right? Like I don't have any marketing or business or, luckily I have people in my life that do know about business and things. So they've helped me walk through a lot of this and helping me. But I do think that is kind of one of the things with vets, right? Like we don't have any of that. So certainly social media or any of those things, like I'm welcome to suggestions or, any sort of help with that.
Ginger, you're muted. I can't hear you, Ginger. Can you hear Ginger?
Okay, yeah, no, I'm here.
Okay.
Sorry about that. There was noise going on, so I muted myself and then I forgot. So if you're a marketing person, and if that's you, if you can put that hat on, if you have press releases or if you already have something on social media, things that we can share, that would be great. Obviously, we're going to share this podcast out everywhere, but sometimes, I think what I said earlier was, I'm on a lot of these groups on Facebook, and they're like, the oncologist can't see me for, until April, and I'm like, or, they're like, well, they went to their GP and they said it's cancer and there's not anything they can do about it. Or their GP told them that their dog had cancer. They amputated their dog's leg and the dog wound up not having cancer. So, I mean, there's just, it's horrible. I can't look at those things very often. So if there's just like a little blurb that I can just copy and paste into some of those pages, that would be helpful. That would be great.
Sure. Yeah. Yeah, no, I'd be happy to share.
what I like what we said,
Thank
what I like what you said is that you kind of had, why are you doing this? You had no business doing it, but you're doing exactly what I think is needed of. You're trying to find solutions to the many problems, challenges that we have, and the pet cancer provider parent ecosystem that we have. And we need bright, young, energetic, creative thinkers out there that are trying to find stopgap solutions, because you really are kind of a stopgap solution, because it doesn't sound like you don't have do you have a bricks and mortar practice? Are you just entirely teleconsulting, or do you have a bricks and mortar practice too?
I'm just teleconsulting. It's one of those, I'll kind of see, could I maybe pivot? I've definitely had a lot of clinics reach out to me to go there physically, but right now I'm just the teleconsulting.
I like that because we have that problem with the foundation and nonprofits is infrastructure. Everyone, business, nonprofit, for-profit, always has infrastructure problems. And by you not having an actual bricks and mortar clinic, that provides you with a unique opportunity to save costs and allocate those to other more important areas that would provide value in other areas. So I really now like your model a lot, and I'm excited that we're having conversation this early, and Fuzzybutts and Friends, and also for the pet cancer care consulting company that you started as well. I want to wrap it up here. I know you're on a tight schedule today. I always like to leave it with what is a final message, Dr. Venable, that you have to our audience that are pet parents that have either been through cancer in their companion animals before, or they're going through it for the first time? What do you have to say to them?
I would say, I guess first, take a deep breath, right? Because it's scary. It's, just builds up all these emotions. Because a lot of us too, not only are we worried about our pet, but we also have memories or associations with people, right? That we've known that have had cancer or different things. So first I'd say take a deep breath. And then really, I would really enforce that knowledge is power. So just getting the information and getting it from a credible source. I think sometimes people go a little too crazy down the Googling rabbit hole, and there's great information out there and there's not good information out there. So I think, but I do think it's really important to get knowledge, because I think sometimes people, and even vets, they don't refer unless they think, oh, this owner's going to do IV chemo, or this owner, and even if you think you don't want to treat or do want to treat whatever, I think getting that information is so important, because I've just seen so many people calm down just when they know what they're dealing with, whether or not they opt for palliative care or they do more aggressive type treatments. I just find that kind of across the board, everybody calms down because they know they're facing, and they know more of what to expect. And they just, and then for everybody in every situation is different, but they just seem to come more to peace with things. So that's what I would tell people is just, make sure you get the information, so like doing that consult, whether it's you go to an oncologist or if you do like a teleconsult but I think, because even if your vet tells you there's nothing we can do, I do find sometimes there's some stigmatism. Like I said, if they feel like, oh, this dog's too old, or this dog's, whatever, they're not going to do anything. Well, but that doesn't mean that person feels any better with you saying that, I think a lot of people just getting that information and they really calm down. And then really what you do after that is, it's kind of mixed and it's very personal.
Yeah, I like that. And maybe you ought to think of that think about that for a new name for your business, is that you're kind of like that. That's really what you're doing. You're providing that reasoned voice of wisdom that I've been through this. We've seen this cancer before. There is a treatment protocol. We have a gold standard that we developed over the years. And that's what pet parents that they want is and again, I love GPs and everything, and I love everybody in this shared ecosystem. We all play an important part, we do, but in many cases, the GP has never experienced that type of cancer. They don't know exactly what to look for, and having that voice of wisdom, of serenity, of it's okay, you know, you're in a situation where we can help you manage this now. That's the value proposition that your company has to offer. And it's a tremendous value that you have to offer pet parents, Dr. Venable. Thank you so much for your time. Got a little choked up there at the end, especially talking about Hudson. And I just went through another cancer scare with my fuzzy butt number 4, Indiana. He's lost a lot of weight, but it looks like he's clear. It's something else anyway. So it's been a rough 6 months, but thank you so much for being here.
Thank you.
Sorry, go ahead. I was going to say, Ginger, any more words from you?
I was just saying thank you. It was very informative.
I sometimes forget about my co-host and leave her out. So I'm really bad at this. I'm learning, I'm getting good, but occasionally she has to throw something from across the screen to hit me and remind me that she's here. But thank you so much, Dr. Venable, for being a part of Fuzzybutts and Friends. And I want you to know, because it's so important for us to get this message out to pet parents and to general practitioners, vet clinics all over the country, you're more than welcome to come back here and use this platform at any time, have any new message, because that's just what it's going to take. It's just going to take all of us continuing to get the message out to pet parents. So Dr. Venable, here at Fuzzybutts and Friends, you're always a friend and you're always welcome back. Thank you so much for being here.
Oh, thank you so much. It's definitely been my pleasure.
All right, everybody. This concludes episode number 5 of Fuzzybutts and Friends. Thank you so much. Puppy up. Talk soon.